Hello, I'm Henry Acosta, and welcome to Health Professional Radio. With us today is the chairman of the National Mental Health Commission, which seeks to help or provide health and support for the mentally ill. We have Professor Allan Fels on the show with us to talk about mental health and how important it is for everyone to be aware of it and how impactful our actions can be to everyone who has it. So welcome to the show, Professor. We're glad to have you here.
Thanks. Thanks very much.
And can you give us a little bit more in-depth or a little bit more introduction about who you are and what you do?
Yep. So I'm the part-time chair of Australia's National Mental Health Commission, which is an independent Commonwealth government body that reports on the state of mental health, that makes some policy recommendations, and generally holds government, especially, and the system accountable for its performance.
I see. And what inspired you into getting into this line of work?
Well, it's personal. One of my daughters has severe persistent schizophrenia, and that made me very interested in the topic. And I do some, so to speak, private activities under which I work with a foundation that tries to provide accommodation, care and support for people with severe mental illness. But the Commission is a major policy recommending agency of the Commonwealth Government that tries to take a general view of the whole of mental health in Australia and what's going on and what should be done.
And what are the ways that we can do to get a healthier mindset?
Well, let me set out the general problems. The first one is that something like 3 to 4% of the Australian population, and it's no different from the rest of the world, has severe, usually persistent mental illness, problems like schizophrenia, bipolar, acute depression, and so on. And they need a full set of remedies, approaches and policies that address their medical needs, that also address their whole of life needs. Typically they need help and support with accommodation, they need psychosocial support. They would be great if they had something to do, especially a job and some connectedness with society. So that's sort of one end of the spectrum. The next is maybe 15% of the population on top of that have got significant mental health, mental illness problems of a level that does require treatment, generally health treatment. They might be people with depression, with anxiety disorders and so on. Often those problems are episodic. They occur in episodes rather than being persistent, but it is a very big population out there also that needs help.
I see. And let's say I have depression. When do I know, or when should I seek help or seek out help? Since let's say I have it.
Well, most people would ask their GP, and the GP can give them some help and also may refer them. Again, there are many categories of depression from severe to sort of mild. If you're at the severe end, quite possibly a GP will recommend that you take a bit of medicine or some pills and get some talk therapy, cognitive therapy with a psychologist. If you're at the non-severe end, maybe they won't suggest pills and medicine, but rather that you talk to a professional, typically a psychologist. So that's a slightly shallow answer to this question of what to do about depression. One other thing which is emerging these days is that there are more e-health, electronic health, or internet-based sources of support. So you can, if you don't want to go to a doctor, or you're a bit shy about it, or you don't want to own up, or you're in a remote part of Australia and in those services, if you look around on the internet, you will find some e-health services. For example, questions that they ask you, and that gives you, and if you give them some answers, the computer will just give you a bit of an idea what you might do. It might say, hey, your problems aren't that severe, and maybe do a couple of easy things, exercise or something. Mm-hmm. Or they might say, look, we think it would be a good idea for you to talk to a doctor, and the doctor could determine whether you've got a serious problem or not.
Can you go in depth on how we should treat other people with mental illnesses?
Yeah. So if I then went to the severe end, people with schizophrenia and so on. Mm-hmm. These are, in very broad terms, there's a genetic driver of many forms of mental illness, and it may be triggered by episodes, by events, by the environment. There's some interaction between them. But at the very severe end, life is very tough for a person with schizophrenia. And above all, in my view and most people's view, they need treatment. A lot of people, however, don't get treatment, or they arrive too late at the treatment desk. Mm-hmm. So the ideal treatment is, of course, again, see a GP who'd probably send you on to a psychiatrist or the local community mental health system. And now the sorts of remedies, again, I'm overgeneralizing, but where there's severe schizophrenia and the person's brain is not functioning too well, they're very confused, they may have hallucinations, delusions, they may hear voices and other unpleasant noises in their head. Mm-hmm. Where they are, they need some medicine, and the medicine generally suppresses the psychosis. However, the medicine is somewhat imperfect and there can be side effects, and it doesn't cure every single facet of the illness. There is, what I'm saying sounds very medical, and indeed medical treatment is really important, mm-hmm. but we need to think more broadly about a person. So let's say someone goes to the doctor and they get a bit of a temporary fix with some medicine, but then they sleep in the street, they're homeless, or they sleep under a bridge, or they live in substandard housing, mm-hmm. then they are likely to relapse and be back quite possibly in hospital in acute care. So any serious way of dealing with severe mental illness requires a broader approach than just medicine. I always put accommodation at the top of the list, but also having something to do and having some psychosocial help. So typically a person in this condition not only needs to take medicine and possibly be supervised, but to be in touch with psychologists or psychiatrists who can keep an eye on them and talk about their problems. So access to psychosocial services, and then also, if possible, that they get a job or have something to do. And there's a whole set of options around jobs. And then another thing is to have some kind of social connectedness, not to be isolated and living on their own. So there are some of the elements of what needs to be done with people with severe mental illness. But somewhat unfortunately, in reality, a lot of people don't get or take or have a kind of preventative approach or an early intervention approach. Mm-hmm. So they aren't treated, and then they get into a bad shape, things go badly wrong, and they end up in acute care in a hospital. That's not a good thing. And also, it's it would be better if they could get onto treating the problem early. And so we need a big emphasis in mental health on prevention and early intervention rather than waiting till the person's fallen over the cliff, got to the bottom of the cliffs in a horrible mess. We try to get to them before they fall over the cliff.
With regards to mental health, since everyone, the talk is about depression and all that, what are the more common mental illnesses that we usually don't know about that usually occurs with everyone rather than depression?
Yes, so I've got a slightly oversimplified way of thinking about it. As I said, maybe 3 or 4% really severe, another 15% with problems that do require treatment of some kind or therapy. And then the rest of the population, their mental health is really important. The mental health of a country is really important. It's just as important, and actually Prime Minister Turnbull uses a very good expression on this. He talks about the mental wealth of a nation and that it's just as important as the physical wealth. So we all need to try to manage our life to avoid undue stress, mental health problems and so on. And that requires that in our own life we manage ourselves as well as possible. It means at work that employers should be trying to create an environment which does not cause enormous stress for people, but is, considerate of their psychological needs.
What are the most common misconceptions that you guys usually get about mental health or that you usually face with regards to mental health?
Well, amongst professionals, there are not too many misconceptions, but amongst the general community, there is quite a lot of stigma and prejudice against people with mental illness. That's just a fact, and that is a real big problem that holds back the priority that politicians should give to mental health, and that can make life very difficult for people with mental illness.
I see. And can you give us the main takeaway message that you want our audience to hear for this interview?
I guess the main takeaway to your listeners is that I would expect, I'm pretty sure most of them have some understanding of the challenges of mental illness and want to do things about it. I think it's quite important that we work hard on governments and the community, that they make a higher priority of mental health, because it tends to get a rather low ranking in government policies. We like to see a higher priority given to it.
Well, that's all our questions for today, and thank you so much for being on the show.
Thanks a lot. Good. See you.
And that was Professor Allan Fels, the chairman of the National Mental Health Commission. We just finished talking about mental health and how our actions are important to everyone around us. I'm Henry Acosta, and you've been listening to Health Professional Radio. Transcripts and audio are available on www.healthprofessionalradio.com.au or on www.hpr.fm. We can also be found on SoundCloud and iTunes.